The information in this presentation has been developed by the Blue Heron Academy of Healing Arts and Sciences, one of the nation's leading schools of massage therapy, complementary and alternative medicine, in conjunction with the American Medical Massage Association. Cross-infection in the professional arena and in the office is a serious matter and an issue that requires continual management so that you, your staff, and your patients remain safe and healthy. We hope that the information provided in this course will assist you with the safe and effective care of your patients. Welcome to this presentation on professional hygiene and office cross-infection control. Hello, my name is Sandra Bovee, and for the next few minutes, we are going to talk about the important preventative steps that you can take to avoid illnesses in yourself, staff, and patients related to the transmission of infectious diseases in the office and through therapist to patient and patient to therapist contact. Now, let's look at your role in infection control. Infection control and the prevention of cross-infection is a vitally important aspect of the safe and effective practice of healthcare. The most important aspect of in-office and practice infection control is your application of effective infection control procedures. Melba Rhodes, a nurse, defines the ABCs of infection control as asepsis, body hygiene, and a caring attitude, and further explains that these concepts comprise what we should do to help protect our patients and ourselves. Your diligence and common sense is key to protecting yourself, your coworkers, and the patient. Hand washing and skin preparation, disinfectant and sterilization, vital parts of asepsis, and a caring attitude are essential to the ABCs of infection control. Infection control is a valuable asset to our practice, and it is our responsibility to demonstrate this. The last letter in our acronym for the ABCs of infection control is C, or a caring attitude. A caring attitude will be reflected in work practices that support sound infection control principles. Work practices that support the maintenance of aseptic technique and embrace responsibility for each individual's role in infection control can only come from a staff with caring attitudes. This can be accomplished by fostering a team approach through education and support of the therapists as they perform duties that are pivotal in the prevention and control of infection. Focus should be placed on the last of the ABCs of infection control, focusing on the right and wrong of infection control. Our attitude should mirror the plan of asepsis, common sense. By using common sense, we can safely protect our patients and ourselves. Use common sense and a caring attitude to develop a good aseptic conscience, or a continuous awareness of asepsis. Your aseptic consciousness is your set of internal ideals. We have set ideals in the form of policies and procedures to protect our patients and ourselves. Set your ideals at the highest level to give care without doing harm. Pathogens include not only bacteria, but also viruses, fungi and parasites, and prions. The virulence of these pathogens depends on their number, their potency, their ability to enter and survive in the body, and the susceptibility of the host. For example, the smallpox virus is particularly virulent, infecting almost all people exposed. In contrast, the tuberculosis bacillus infects only a small number of people, usually people with weakened immune function or those who are undernourished and living in crowded conditions. Viruses are intracellular parasites, that is, they can only reproduce inside a living cell. Viruses such as HIV/AIDS, hepatitis B and C have the ability to enter and survive in the body for years before symptoms of disease occur. Other viruses, such as the influenza viruses, quickly announce their presence through characteristic symptoms. Hepatitis A is a liver disease caused by the hepatitis A virus. Hepatitis A can affect anyone. In the United States, hepatitis A can occur in situations ranging from isolated cases of disease to widespread epidemics. Good personal hygiene and proper sanitation can help prevent hepatitis A. Vaccines are also available for long-term prevention of hepatitis A virus infection in persons 2 years of age and older. Immune globulin is available for short-term prevention of hepatitis A virus infection in individuals of all ages. Hepatitis B is a serious disease caused by a virus that attacks the liver. The virus, which is called hepatitis B virus, can cause lifelong infection, cirrhosis of the liver, liver cancer, liver failure, and death. Hepatitis B vaccine is available for all age groups to prevent hepatitis B virus infection. Hepatitis B is spread when blood or body fluids from an infected person enters the body of a person who is not infected. For example, hepatitis B is spread through having sex with an infected person without using a condom. The efficacy of latex condoms in preventing infection with hepatitis B is unknown, but their proper use might reduce transmission. By sharing drugs, needles, or works when shooting drugs, through needle sticks or sharp exposures on the job, or from an infected mother to her baby during birth. Hepatitis B is not spread through food or water, sharing eating utensils, breastfeeding, hugging, kissing, coughing, sneezing, or by casual contact. Sometimes a person with hepatitis B infection has no symptoms at all. The older they are, the more apt they are to have symptoms. A patient might be infected with hepatitis B and be spreading the virus and not know it. If they have symptoms, they might include yellow skin or yellowing of the whites of their eyes, jaundice, tiredness, loss of appetite, nausea, abdominal discomfort, dark urine, clay-colored bowel movements, or joint pain. A patient is at increased risk of hepatitis B infection if they have sex with someone infected with hepatitis B, have sex with more than one partner, shoot drugs, are a man and have sex with a man, live in the same house with someone who has chronic long-term hepatitis B infection, have a job that involves contact with human blood, are a client in a home for the developmentally disabled, or have hemophilia. Hepatitis C is a disease of the liver caused by the hepatitis C virus. Hepatitis C is spread primarily by direct contact with human blood. A patient may be at risk for hepatitis C and should contact a medical care provider for a blood test if they've ever injected street drugs, as the needles and/or other drug works used to prepare or inject the drugs may have had someone else's blood that contained hepatitis C on them. They received blood products, or solid organs from a donor whose blood contained hepatitis C. They were ever on long-term kidney dialysis, as they may have unknowingly shared supplies or equipment that had someone else's blood on them. They were ever a health care worker and had frequent contact with blood on the job, especially accidental needle sticks. Their mother had hepatitis C at the time she gave birth. During the birth, her blood may have gotten into their body. They ever had sex with a person infected with hepatitis C. They lived with someone who was infected with hepatitis C and shared items such as razors or toothbrushes that might have had his or her blood on them. Hepatitis D is a liver disease caused by the hepatitis D virus, a defective virus that needs the hepatitis B virus to exist. Hepatitis D virus is found in the blood of persons infected with the virus. Hepatitis E is a liver disease caused by the hepatitis E virus, transmitted in much the same way as hepatitis A virus. Hepatitis E, however, does not occur often in the United States. AIDS, acquired immune deficiency syndrome, is a condition caused by a virus called HIV. This virus attacks the immune system, the body's security force that fights off infections. When the immune system breaks down, you lose this protection and can develop many serious, often deadly infections and cancers. These are called opportunistic infections, OIs, because they take advantage of the body's weakened defenses. You have heard it said that someone died of AIDS. This is not entirely accurate, since it is the opportunistic infections that cause death. AIDS is the condition that lets the OIs take hold. HIV is a virus. A virus is really nothing but a set of instructions for making new viruses wrapped up in some fat, protein, and sugar. Without living cells, a virus can't do anything. It's like a brain with no body. In order to make more viruses and to do all of the other nasty things that viruses do, a virus has to infect a cell. HIV mostly infects T cells, also known as CD4 plus cells or T helper cells. These cells are white blood cells that turn the immune system on to fight disease. Once inside the cell, HIV starts producing millions of viruses, which eventually kill the cell and then go out to infect other cells. All of the drugs marketed to treat HIV work by interfering with this process. Research has revealed a great deal of valuable medical, scientific, and public health information about the human immunodeficiency virus, HIV, and acquired immunodeficiency syndrome, AIDS. The way in which HIV can be transmitted have been clearly identified. Unfortunately, false information or statements that are not supported by scientific findings continue to be shared widely through the internet or popular press. HIV is spread by sexual contact with an infected person, by sharing needles and/or syringes, primarily for drug injection, with someone who is infected, or less commonly, and now very rarely in countries where blood is screened for HIV antibodies, through transfusions of infected blood or blood clotting factors. Babies born to HIV-infected women may become infected before or during birth or through breastfeeding after birth. In the healthcare setting, workers have been infected with HIV after being stuck with needles containing HIV-infected blood or, less frequently, after infected blood gets into a worker's open cut or a mucous membrane, for example, the eyes or inside of the nose. There has been only one instance of patients being infected by a healthcare worker in the United States. This involved HIV transmission from one infected dentist to 6 patients. Investigations have been completed involving more than 22,000 patients of 63 HIV-infected physicians, surgeons, and dentists, and no other cases of this type of transmission have been identified in the United States. Some people fear that HIV might be transmitted in other ways. However, no scientific evidence to support any of these fears has been found. If HIV were being transmitted through other routes, such as through air, water, or insects, the pattern of reported AIDS cases would be much different from what has been observed. For example, if mosquitoes could transmit HIV infection, many more young children and pre-adolescents would have been diagnosed with AIDS. All reported cases suggesting new or potentially unknown routes of transmission are thoroughly investigated by state and local health departments with the assistance, guidance, and laboratory support from CDC. No additional routes of transmission have been recorded, despite a national sentinel system designed to detect just such an occurrence. Scientists and medical authorities agree that HIV does not survive well in the environment, making the possibility of environmental transmission remote. Although HIV has been transmitted between family members in a household setting, this type of transmission is very rare. These transmissions are believed to have resulted from contact between skin or mucous membranes and infected blood. To prevent even such rare occurrences, precautions, as described in previously published guidelines, should be taken in all settings, including the home, to prevent exposures to the blood of persons who are HIV infected, at risk for HIV infection, or whose infection and risk status are unknown. For example, gloves should be worn during contact with blood or other body fluids that could possibly contain visible blood such as urine, feces, or vomit. Cuts, sores, or breaks on both the caregiver's and patient's exposed skin should be covered with bandages. Hands and other parts of the body should be washed immediately after contact with blood or other body fluids, and surfaces soiled with blood should be disinfected appropriately. Practices that increase the likelihood of blood contact, such as sharing razors and toothbrushes, should be avoided. Needles and other sharp instruments should be used only when medically necessary and handled according to recommendations. And dispose of needles in puncture-proof containers. Healthcare personnel are at risk for occupational exposure to bloodborne pathogens, including hepatitis B virus, hepatitis B, hepatitis C virus, hepatitis C, and human immunodeficiency virus, HIV. Exposures occur through an exchange of blood from open wounds, needle sticks, or cuts from other sharp instruments contaminated with an infected patient's blood, or through contact of the eye, nose, mouth, or skin with a patient's blood. Important factors that influence the overall risk for occupational exposures to bloodborne pathogens include the number of infected individuals in the patient population and the type and number of blood contacts. Most exposures do not result in infection. Following a specific exposure, the risk of infection may vary with factors such as the pathogen involved, the type of exposure, the amount of blood involved in the exposure, or the amount of virus in the patient's blood at the time of exposure. The body has natural barriers to infection, and these natural barriers include intact skin and mucous membranes, nasal cilia, small hair-like projections that filter inhaled air and trap microorganisms, lung macrophages, large white blood cells that ingest microorganisms, other cells, and foreign particles, acidic environment in the stomach, urine, and vaginal secretions, tears that continually wash away pathogens and contain substances that destroy some types of bacteria, and saliva which contains several bacterial inhibitors. You should have in place a system for reporting exposures in order to quickly evaluate the risk of infection, initiate treatment available to help prevent infection, and monitor side effects of treatments, and determine if infection occurs. This may involve testing your blood and that of the source patient and offering appropriate post-exposure treatment. Many needle sticks and other cuts can be prevented by using safer techniques, disposing of used needles in appropriate disposal containers, and using medical devices with safety features designed to prevent injuries. Using appropriate barriers such as gloves, eye and face protection, or gowns when contact with blood is expected can prevent many exposures to the eyes, nose, mouth, or skin. If you are exposed to the blood of a patient, you need to follow these steps. First, immediately following an exposure to blood, wash the area, cuts, or needle sticks with soap and water, flush the nose, mouth, or skin with water, and irrigate eyes with clean water, saline, or sterile irrigants. No scientific evidence shows that using antiseptics or squeezing the wound will reduce the risk of transmission of a bloodborne pathogen. Using a caustic agent such as bleach is not recommended. And second, report the exposure to the appropriate medical personnel responsible for managing exposures and providing post-exposure assistance. Prompt reporting is essential because in some cases, post-exposure treatment may be recommended, and it should be started as soon as possible. Discuss the possible risks of acquiring hepatitis B, hepatitis C, and HIV, and the need for post-exposure treatment with the professional managing your exposure. You should have already received hepatitis B vaccine, which is extremely safe and effective in preventing hepatitis B infection. The Centers for Disease Control and Prevention released new guidelines that advise the use of alcohol-based hand rubs to protect patients in healthcare settings. Clean hands are the single most important factor in preventing the spread of dangerous germs and antibiotic resistance in healthcare settings. More widespread use of products that improve adherence to recommended hand hygiene practices will promote patient safety and prevent infections. The CDC estimates that each year, nearly 2 million patients in the United States get an infection in hospitals, and about 90,000 of these patients die as a result of their infection. Infections are also a complication of care in other settings, including long-term care facilities, clinics, and dialysis centers. Improving hand hygiene will help prevent the spread of germs from one patient to another. Data shows that healthcare personnel may be more inclined to use alcohol-based hand rubs because they are more convenient to use. Recent studies show that these hand rubs actually reduce the number of bacteria on the hands more effectively than washing hands with soap and water. Healthcare personnel are always on the go, which sometimes makes hand washing with soap and water difficult, said Dr. Steve Solomon, the acting director of the CDC's Healthcare Quality Promotion Division. These hand rubs should help promote hand hygiene because they are much more accessible than sinks, take less time to use, and cause less skin irritation and dryness than many soaps. The CDC has released guidelines to improve adherence to hand hygiene in healthcare settings. In addition to traditional hand washing with soap and water, the CDC is recommending the use of alcohol-based hand rubs by healthcare personnel for patient care because they address some of the obstacles that healthcare professionals face when taking care of patients. The very nature of healthcare settings makes them vulnerable to the spread of infections because they serve patients who are ill and are therefore susceptible hosts. Patients with altered immunity, such as people with cancer or HIV/AIDS, are at high risk for infection. Surgical patients are at risk because any incision creates a new portal of entry for pathogens. Elderly patients may have weakened immunity simply because of their age. Healthcare workers are themselves at risk of infection because of their close daily contact with patients who may harbor pathogens. This infection control is a primary component of safe, effective patient care. Another important step in preventing in-office cross-infection is to maintain a clean office and clinic environment. One of the most important functions of cleaning is to protect the occupants of the office, patients, and staff from cross-infection. The removal of dust particles, pathogenic microorganisms, and other harmful materials not only prolongs the health of an office, but its occupants as well. Healthcare workers need to understand the following terms to ensure they are properly caring for their office environment: pathogenic microorganisms, fomite, cross-infection, and/or nosocomial infection. Pathogenic microorganisms. A pathogenic microorganism is a bacteria, virus, or fungi that causes disease. Pathogens enter the human body through mucous membranes. When a person who is sick sneezes, they release pathogens into the air and onto the surfaces inside an office. In order to remove these pathogens, workers need to know how they spread and where they can be found. Fomite. A fomite is a carrying mechanism for pathogenic microorganisms. Faucets, doorknobs, walls, and any other surfaces or objects are fomites. Water and dust particles also can serve as fomites because they can carry pathogens. If these fomites are not removed or disinfected on a regular basis, they are helping bacteria travel and grow inside an office. Using an effective disinfectant, clean cloths and mop heads, and changing cleaning solutions on a regular basis can greatly reduce the spread of bacteria via fomites. If an office is not being cleaned properly and bacteria are not removed through disinfection, the effects can be quite problematic. A contaminated office can affect an occupant's health and the quality of life inside the office. Cross-infection, nosocomial infection. A patient contracts a cross-infection or nosocomial infection while staying in a healthcare facility. People often acquire these infections during or after surgery or other invasive procedures. Experts have estimated that roughly 2 million patients per year in the United States are infected this way. It is estimated that roughly 90,000 people die from infection complications. While this cannot be precisely linked to the cleaning functions, therapists and clinicians need to understand how their work may affect the office and its occupants. Ideally, cleaning operations should remove the pathogens. At the very least, cleaning techniques should be dedicated to preventing pathogen spread. Appropriate cleaning and sanitation practices are essential to reduce the spread of infection. The CDC guidelines include the following recommendations. Keep surfaces, for example floors, walls, and tabletops, visibly clean on a regular basis and clean up spills promptly. Avoid large surface cleaning methods that produce mists or aerosols or disperse dust in patient care areas. And follow proper procedures for effective uses of mops, cloths, and solutions. In general, reusable medical devices or patient care equipment that enters normally sterile tissue or the vascular system or through which blood flows should be sterilized before each use. Sterilization means the use of a physical or chemical procedure to destroy all microbial life, including highly resistant bacterial endospores. The major sterilizing agents used are moist heat by steam autoclaving, ethylene oxide gas, and dry heat. However, there are a variety of chemical germicides that have been used to reprocess reusable heat-sensitive medical devices and appear to be effective when used according to manufacturers' instructions. These chemicals are rarely used for sterilization, but appear to be effective for high-level disinfection of medical devices that come into contact with mucous membranes during use. Disinfection means the use of a chemical procedure that eliminates virtually all recognized pathogenic microorganisms, but not necessarily all microbial forms, for example, bacterial endospores or inanimate objects. There are 3 levels of disinfection. 1. High-level disinfection kills all organisms except high levels of bacterial spores. 2. Intermediate-level disinfection kills mycobacteria, most viruses, and bacteria. And 3. Low-level disinfection kills some viruses and bacteria. Heat-stable reusable medical devices that enter the bloodstream or enter normally sterile tissue should always be reprocessed using heat-based methods of sterilization, for example, steam autoclave or dry heat oven. Reusable devices or items that touch mucous membranes should, at a minimum, receive disinfection between patients. Medical devices that require sterilization or disinfection must be thoroughly cleaned to reduce organic material or bioburden before being exposed to germicide, and the germicide and the device manufacturer's instructions should be closely followed. Except on rare and special instances, items that do not ordinarily touch the patient or touch only intact skin are not involved in disease transmission and generally do not necessitate disinfection between uses on different patients. These items include crutches, bedboards, blood pressure cuffs, and a variety of other medical accessories. Consequently, depending on the particular piece of equipment or item, washing with a detergent or using a low-level disinfectant may be sufficient when decontamination is needed. Extraordinary attempts to disinfect walls, floors, or other environmental surfaces are not necessary. However, cleaning and removal of soil should be done routinely. An inexpensive environmental surface germicide effective against HIV is a solution of 1 part bleach to 9 parts water, prepared daily. However, bleach is corrosive to metals, especially aluminum, and should not be used to decontaminate medical instruments with metallic parts. Chemical germicides that are EPA approved for use as hospital disinfectants should be used to decontaminate spills of blood or other body fluids. Once devices or equipment have been disinfected, proper post-disinfection handling and storage are required to maintain these items in a ready-to-use condition. The major limitations of chemical disinfectants are: only some are effective against spores or viruses, variable sensitivity within groups of organisms, for example, bacteria, concentration and pH are critical, slow activity, many are inactivated by organic matter, they do not penetrate crevices, and toxic and allergic side effects. Autoclaving is a sterilization technique that is commonly used to sterilize acupuncture instruments. Autoclaving has the following advantages and disadvantages. First, the advantages: reliable, inexpensive, kills all microbes. And the disadvantage is that it is not suitable for heat-sensitive objects like certain plastics. Every health professional should recognize the potential sources of cross-contamination in the healthcare environment and apply infection control procedures to avoid cross-contamination. These sources include surfaces or equipment that require cleaning between patients, such as tabletops, practices that contribute to hand contamination and potential for cross-contamination, and implications of reuse of disposable equipment or devices. The most important thing that you can do in your office and healthcare practice to accomplish infection control and to prevent cross-infection is to plan and to execute a culture of infection control. If you establish conscientious infection control standards of practice, you will significantly reduce the likelihood of cross-infection in your practice.